Hey, are you suffering from back pain right now? Well, if you are not alone. 80% of Americans at some point during their lifetime will experience back pain, and doctors are constantly fighting to ease that pain. But are they incorrectly treating what the patients need so much? Here to separate fact from fiction is our own expert, a member of our Fox News Medical Aid team, Dr. Mark Siegel. Dr. Siegel, back pain, a big deal to me. You've helped me out before in the past, so let's get through myths and facts. You ready? First off, back pain usually goes away on its own. Fact or myth?
That's absolutely true, and people don't realize that. They're there with terrible back pain. And by the way, Brian, as we were saying, what back pain is because there's a tight compartment of muscle, nerve, and bone in one area. So those nerves get inflamed, and you get back pain. It's very easy to get it. Then you get a muscle spasm, and you think it's going to last forever, but most of the time, it goes away on its own.
All right, so they are. Now,
within a few months.
Okay, the guidelines are always right.
Well, I'm saying that that's myth, and I'll tell you why. Guidelines for back pain say that we overdo the treatments, that we overdo the MRIs, that we overdo the steroids, that we overdo the narcotics and the surgeries. That's true, but guidelines in general I don't believe is good medicine. Brian, guidelines should be taken the place of by the art of medicine, which is one-on-one. You came with a question, I had an answer. It depends on the person.
Because you can't be, it's too general. Back is something that needs to be
Some people need surgery, some people don't.
All right, here, let me give you this scenario. How about this? MRI scans, CT scans, and specialists are underutilized. Is this a myth or is this a fact?
That's a myth. They're actually overutilized. And let me tell you, 11% of people with back pain end up with an instant CT scan or MRI. The truth is, most of the time, physical therapy, heat, anti-inflammatories work, and you don't need imaging. It's only if the pain is radiating down your legs, or in the case of the neck, radiating down your arms. If there's a radiating factor, or it doesn't go away, or it's debilitating, then you start needing the imaging studies.
Here's another question for you. Narcotics are a good choice for back pain. Is that a myth or is that a fact?
That's totally a myth. And what's really disturbing about narcotics, Brian, is that they're up to about 30% of back pain patients now. A new study out of Harvard shows that in the past decade, we've increased the prescriptions of these to up to 30%. They're addictive. They cause terrible problems later on. They don't solve the inflammation that I'm talking about in the back. It's the wrong treatment most of the time.
And Ian just had this done behind camera one. Back surgery is frequently overdone. Fact or myth?
Absolutely a fact. Because you know why? Initially with back surgery, you may have relief. It may work for a couple of years. Studies show out of the NIH that down the line, 10 to 40% of back surgeries fail. Now, there are reasons for it. Sometimes if you've got a really bad disc, again, if you have radiating pain, there may be indications for back surgery, but don't rush to it just because you have some arthritis in the spine. Bad idea.
And quick overall question, what makes the back so challenging?
Well, again, the back is challenging because we're using it all the time, because we started off as apes. We weren't supposed to be standing up. We put tremendous pressure on the back when we sit, when we stand, and then the muscles, nerves, and bones are very tightly together. They get inflamed easily. You get the muscles in spasm, the nerves inflamed, and there you are. You have a problem. But physical therapy, heat, anti-inflammatories, muscle relaxants are usually the initial treatment. And
special thanks to early Americans, because I would not want to be crawling right now. Whosever idea was to stand up, good move. You know, even though it does cause some back pain.
Absolutely. And plus, you don't want to be eating bananas all day long.
Absolutely not. Dr. Mark Siegel, very good point. Fox News Medical Aid team dispelling some facts there. And Ian, I'm sure you're happy with your back surgery, though, right?
Yeah.
He is. Ian's happy.
For the time being.
Yes.